This week, an FDA panel gave COVID-19 vaccines for kids ages 5 to 11 a thumbs up. An advisory panel. We're anticipating a decision from the CDC now in the next few days. Then soon it'll be decision time for parents. And here to answer your questions is 9Health expert Dr. Pyle Coley. Good morning, Dr. Coley.
Good morning.
So this is a huge decision when it comes to your children. So why should kids be vaccinated against COVID-19?
You know, Natasha, we've been talking this morning about how the cases are going up in this particular population, the 5 to 11-year-olds. So the first reason is to protect the kids themselves. Now we know, thankfully, they're not as likely to end up in the hospital, but they are likely, potentially, if they do, to get MIS-C, multi-system inflammatory syndrome in children. We've unfortunately lost a few kids, so we have to protect our kids, get them back to their activities after school and whatnot. The second reason is to protect the adults, because kids interact with grandparents, with teachers, with coaches, and what have you. And we know that if the kids are not vaccinated, they're higher risk of catching and spreading the infection. And the third reason is to really end the pandemic. This is a huge proportion of our population, and until we get them vaccinated, we're just going to keep propagating the spread.
Right. You know, and I think that's the big thing. People may say, you know, well, kids don't get sick from COVID as much, but they're still spreading it, and that's the message too.
That's exactly right. And until we get them vaccinated, the rest of us can't get our lives back to normal. And it's just a matter of time before one of those variants becomes resistant to the vaccine. Then everybody starts all over.
Okay, so let's talk about reactions. Can a child get a reaction from the COVID vaccine?
They can. We have noticed some reactions in kids, very similar to what we have seen in adolescents and adults. So fever, muscle aches, headaches, and fatigue are the most common reactions. Now, thankfully, the intensity of those reactions actually appears to be lower in kids than it is in adults, and I think that may have something to do with the dose being different.
Right. Now, let's talk about the dosage. I know it's a little preliminary considering we haven't gotten full authorization of it just yet, but once it does happen, what are the doses looking like and how will they be spaced apart?
So the dose is 1/3 of the full adult dose. So the adult dose was 30 micrograms. This is 10 micrograms for this population. And the spacing is very similar to what we saw in adults. So day 1 and day 21. So you want to spread them apart by 21 days. And after that 21 days, it takes 2 weeks to get full immunity. So about 5 weeks for the whole program. Very similar again to adults. And we do expect kids will get boosters as well. We don't yet know the dose of the booster, but probably like adults, kids will need those too.
Okay, well, we're on the road towards that. Dr. Coley, thank you so much.